One of the first body systems affected by impaired nutrition is the immune system. Metabolic stress subdues the immune system's ability to protect the body. It is worse if the patient is malnourished. And then this deadly cycle occurs, where recovery requires breaking this cycle. So a well-nourished body will not be hurt by infection the same way that a poorly nourished one is. Look at the developing countries where infection is a leading cause of death and protein malnutrition is rampant. So your body's response depends on the magnitude and the duration of the stress. So first you have this ebb phase, which is usually the first 12 to 24 hours. It's characterized by shock with hypovolemia and a diminished tissue oxygenation. Your cardiac output, your oxygen consumption, your urinary output, and your body temperature all fall, whereas your glucagon and your catecholamine, the stress hormone levels, rise. The treatment here when the patient's in the ebb phase is to restore blood flow to the organs, maintain oxygenation to all the tissues, and stop the bleeding, aka return the patient to homeostasis. This phase, the ebb phase, ends when the patient is hemodynamically stable. Then comes the flow phase. This is usually 36 to 48 hours after injury. The metabolic response to stress is going to be, you're going to see a spike in these counter-regulatory hormones. It's going to promote the breakdown of your stored nutrients to make energy available. As the body stores and the tissues are catabolized, energy expenditure and metabolic rate is going to increase, causing a hypercatabolic state where your oxygen consumption, cardiac output, CO2 production, and body temperature are going to rise. The length of the flow phase, which is going to be days, weeks, or months of the depend on the severity and the development of complications. These patients are in a hypermetabolic state. When you are in the flow state, you are in a hypermetabolic state. All these things today we're going to be talking about are basically hypermetabolic states. So the main thing here is that these patients are in a poor nutritional status, and this is going to compound the problem, make it worse. So we need to intervene as the nurse. We need to early monitor, or we need to early assess, monitor, intervene, correct. All right, so here you can see the immune system is one of the first our body's functions that are affected by imbalanced nutrition or impaired nutrition is going to be the immune system. And you can see that there's lots of different components here that are affected by it because these things all need, for example, protein in order to be created. If you don't have nutrition to do that, if you're only consuming or just have enough calories just to survive, your body's not going to be able to make new cells. So here you can see this is what are the effects of malnutrition on the immune function. The big one you can see there is like the microvilli flatten, and that's going to cause a reduced nutrient absorption and decreased antibody secretions. Not good things. All right, so here it's showing you that the glycogen is depleted within the first 8 to 24 hours, and so we're doing breakdown of our lean body mass into these amino acids. Then we can take those amino acids and make it into glucose for energy. By doing that, you can see we are going to impair the immune system function, increase risk for infection, delay the wound healing, and we're going to increase the risk for death. This is just showing you that things like some stress hormones increase your blood glucose levels, metabolism, and also cause your body protein catabolism. I'm not going to ask you specific hormones, but just know in general the stress hormones increase your blood glucose levels. It's going to increase your metabolism, and it's going to increase the breakdown of protein. All right, so that breakdown of protein, of body protein, is because you have a deficiency. So it's going to increase your risk for infection, delay and impaired wound healing, and increase your risk for mortality. So we need to assess this patient, we need to protect that lean body mass, and we need to prevent malnutrition from occurring, and if they already have it, we need to correct it. So what are we going to do? We need them to increase their protein. They may actually need to increase by as much as 2 grams per kilogram in severe stress situations so that we can then resist infection, we can then and restore the blood volume, etc. We need to increase calories to replace those losses from when we weren't taking stuff in. Again, we are in a hypermetabolic state, so we need more calories just to breathe and sit there. We want to make sure we're sparing protein and we're not using protein for calories, that we're using it for wound healing. And we want to get the patient back up to a normal weight. If they, for example, the BMI went from 20 to 17, we want to get them back up by increasing calories. We also need to increase water. The requirement is going to be based on their age, but in general, we need to replace fluid if one of these things are present. Now, if your patient doesn't have any of these things here, then we're not going to do that. We also do need to be careful, though, of, again, we're trying to get homeostasis, and so we can sometimes overcorrect things, and we can actually cause overhydration, and that is going to be a complication we don't, it's going to not be good for the patient either. Now, another thing to know is that decreased renal output is a frequent complication of metabolic stress. So we want to be monitoring intakes and output, make sure they're making at least 30 cc's of urine per hour. I know that, remember, again, if you remember back when we talked about water, it's a solvent. So we're going to use that to transport things to and from the cells, help regulate body temperature. So if we don't have enough fluid, all those things that water does are not going to be able to happen. So we need to get this patient back into homeostasis. So this is going to show you about for vitamins and minerals what the effect of stress is. So you need most of your vitamins and minerals to increase. If you meet your calorie requirements, most likely you're going to be getting enough of your vitamins and minerals, but not necessarily because, we have talked about malnutrition in general, and that's where the patient's getting enough calories but not enough vitamins and minerals. So as long as they're eating a good, healthy diet, they should be, getting some fruits and vegetables in, they should be meeting their vitamins and minerals. But you can see here, we're going to pay some special attention to specifically vitamin C, vitamin A, beta carotene, and zinc. Those are going to specifically need to be taken in to help with wound healing. And you can see here, for example, we dramatically increase potentially the vitamin C intake as well as getting them on a zinc sulfate supplement. And I'm not a big fan of supplements, so if I'm saying that we need to supplement it with a tablet, it's really, important. All right, so why do we need to increase vitamin C? Well, this is telling you what is vitamin C going to help with? And there's research out there that shows that a vitamin C deficiency results in increased incidence of wound dehiscence, or opening up, of defective collagen formation, and decreased wound tensile stress, which means it's easier for a wound to open up. So we need to make sure you're getting enough vitamin C so those wounds that have been stapled or sutured do not, for example, when abdominal wound doesn't open up while you cough. Once again, zinc is essential for wound repair. This is also just giving you some other examples of the other vitamins and minerals. Once again, you should already know what these vitamins and minerals do in general. So things like iron should be no surprise here. That it's going to help with oxygen delivery, which we talked about earlier in these slides, about the need for oxygen. All right, let's talk about either going septic or any sort of traumatic injury. What I mean by traumatic injury is going to be some kind of external violence, like a gunshot wound, being stabbed, being in a motor vehicle accident. So they're going to be, again, hyperglycemia is going to be caused by both an increase in gluconeogenesis by the liver and a decreased intake by the cells. So in the ebb phase, insulin levels are going to be depressed. So again, that's going to put you at high risk for hyperglycemia. And then in the flow stage, they become normal, but they're still depressed in relation to your hyperglycemic state. So now your insulin production goes back to normal, but you're in this hyperglycemic state, so it doesn't compensate enough for it. It goes back to normal when it really should be at 130%, for example. So hyperglycemia is common. That is why you're going to see in the ICU, your patient might have no history of diabetes, and we're checking blood sugars because it's so common to occur. Then there's the stress-induced changes that can cause skeletal muscle to decrease its intake of glucose. Another reason, again, if your cells are not picking up the glucose, it's just going to stay in the blood. All right, then we'll talk about lactate. So lactate is a common thing that we test for to find out that somebody is septic. And it's going to be increased in both burn and trauma patients. And like I said, this lactic acid is a marker used to assess for sepsis. And it can be converted to glucose by the liver, once again, causing your blood sugar to increase. Fever. So again, we need to support this higher metabolic rate. And so we're going to need to do extra calories and fluids. So if they're feverish, they're going to be sweating to counteract, to try to get back to homeostasis. So you're going to need to increase fluid intake as well as extra calories. Pressure ulcers. So In this case, this is a nice little picture right here on the heel. Heel is the second most common place after the buttock region. Nutrition therapy is going to play a crucial role in treatment. So you can see here we need to make sure they're getting enough calories in. And if they're underweight or losing weight, we're going to bump it up even a little bit higher. I do not expect you to know these specific numbers. We also are going to need to increase protein, so we want them to be at about 1 to 1.5 grams per kilogram. That's just higher than the normal 0.8 because you need protein to create new cells. Maintaining adequate hydration is necessary to maximize healing of these pressure ulcers, as dehydration is going to decrease blood volume. By decreasing blood volume, we're going to reduce the delivery of oxygen, nutrients, and immune cells to the damaged tissue. Now, the other thing is the effect of oral hydration on skin microcirculation in healthy young adults and midlife and older adults was reduced when there was not enough hydration. So it's very important to make sure they're getting enough hydration to help wound heal. Another thing too is if they are a smoker, they're going to need to increase their vitamin C because remember, we talked about with smokers, or when we talk about vitamin C, smokers need excess vitamin C. So if we need vitamin C for wound healing, and they're a smoker, they're going to need more. You again have to be careful about fluid intake, even though I said it's important to maintain adequate hydration. We don't want to overhydrate this person because, especially if like your patient has heart failure or renal disease, we cannot just push fluids on specifically that type of patient. All right, protein, energy, malnutrition. We've talked about this before. Big things here you can see is for kwashiorkor, the albumin, the prealbumin is going to be low, whereas in marasmus, where they need more protein and they need more calories, those labs are usually going to be in the normal range. Kwashiorkor is going to be more of acute, whereas this is going to be chronic. You can see what these kind of look like here. You can read this on your own. But then there's actually this new part. This has all been review stuff. The new part here is this thing called marasmus kwashiorkor mix. So this is where the acute stress occurs in a chronically malnourished patient. So for example, you have a patient who is an alcoholic who's been chronically malnourished. They now get in a car accident, and so now they have an acute illness. They have acute trauma, which is going to end up throwing them into this marasmus kwashiorkor. Another example could be a malnourished older adult falls and breaks their hip. So they now have this acute stress that occurs. This is life-threatening. They're at very high risk for complications like infection, and we need to identify these patients early so that we can treat them. All right, the next thing that's important here with this marasmus and kwashiorkor is if you identify this patient as having one of these things, we want to make sure that we don't end up causing refeeding syndrome. This is where now the patient's body has adapted to starvation. So for example, maybe a homeless patient I had, as an actual example, we had to be very careful not to cause refeeding syndrome because he was chronically malnourished or undernourished, and he came into the hospital, and now he had easy access to food. It was in the winter, and we wanted to make sure that we did not cause refeeding syndrome. This is where we introduce the nutrition too rapidly in the malnourished patient, and we can actually kill the patient. This is actually more common than you might think of this disease process. It may affect as many as 34% of critically ill patients. Those people who are at increased risk for refeeding syndrome are those alcoholism, chronic undernutrition, malnutrition of the calories of the protein, morbidly obese patients with recent massive weight loss, prolonged fasting, cardiac and cancer cachexia patients. The complications here is we get malabsorption of nutrients, cardiac insufficiency, heart failure, they go into respiratory distress, end up getting into convulsions and a coma, and then that can all lead to death. So what are we going to do here? We need to do frequently monitoring. So we're going to be monitoring, maybe doing labs on a daily basis even, to help identify if refeeding syndrome is occurring. So we're going to look at things like their potassium, their phosphorus, and their magnesium levels. We're going to also weigh them every day. Refeeding syndrome is also more likely to occur if we are doing parenteral nutrition, TPN, versus doing tube feeding. After 1 week of the calories and fluid and sodium can then be liberalized, or can be then we can let them eat more carelessly because it's less likely to occur. Overfeeding can burden the kidneys and the liver, a big reason why we need to be watching all these labs.